already running. So first I would check my physician's orders, make sure it's the correct medication, the dose, the frequency, and I would assess the patient's lab values and allergy history. Um, the doctor has ordered vancomycin. The action is it's an antibiotic that binds to bacterial cell wall that's bactericidal. Um, Implications are severe systemic infection, MRSA used to in patient allergic to penicillin. The recommended dose is 500 milligrams every 6 hours. The side effects include red man syndrome, ototoxicity, and nephrotoxicity. Contraindications are allergy to the drug if patient taking aspirin, aminoglycosides, loop diuretics. Nursing implications would be the baseline whisper test for cranial nerve 8, checking renal functions, culture and sensitivity before giving the first dose. The time to be infused is over 60 minutes. The 50 milliliter bag over 60 minutes times the drop factor of the tubing of 10 would be 8 drops per minute. Eight drops per minute. So now I would add my medication to my Piggyback bag, which my vancomycin is 500 milliliters per ml. I would wash my hands. So I'm going to draw up 1 milliliter of medication. Okay. Insert my medication into the bag. Alrighty. Put that in the sharps container, and I just gently roll my medication to mix. And I would label my bag with the time, the date, the dose, the medication, and my initials. So now I'm going to attach my Piggyback device. I would prime the line. But first, clean my ports. Clamp this off. Prime the drip chamber. Make sure there's no air bubbles. And now I would lower my primary bag, set up my Piggyback, both clamped off. And now I would go to the patient's room.
Hello?
Hi, my name's Brooke and I'll be your nurse today. Can you verify your name and your date of birth?
Jimmy Johnson, 2984.
Mr. Johnson's information matches his ID bracelet. And I will, I've already reviewed your chart and your allergies. It says that you don't have any, is that correct?
That is correct.
Okay, so now I would wash my hands and apply my gloves. My black gloves. Sorry. Oh, no. Okay, and at this point I will we're gonna add, the doctor has ordered vancomycin for us to infuse. At this point I would palpate the site, the IV site, for any phlebitis, pain, heat, inflammation, infiltration, and already hung up the port. Okay, so now I would have actually cleaned the port with alcohol now from the primary line. Then I would clamp my main line off. And I would attach that. Now would do the drip chamber. Do the drip chamber for 8 minutes, or sorry, 8 drops per minute. Okay. And now I will unclamp the main line. And I would remove my gloves and wash my hands. I would continue to observe the infusion and make sure that there's no adverse reactions. I would I already have clamped the piggyback or disconnected the piggyback. And now I would apply the new alligator clamp for the next administration and dispose of my needles and syringes into sharps. Make sure that there's no redness, swelling, pain, tenderness, or inflammation, adverse reactions. And I would document the time, the date, the dose, 500 milligrams, vancomycin, peripheral IV in the right forearm. And I would record the volume of fluid on the MAR and or the intake and the output.